Are you tired of repeated IVF failures? Then what is the solution for your problem? To know this, please watch this video. I am Dr. Sirisha, gynecologist from Avira Fertility Hospital. So when a couple fails to conceive with their own gametes, they need a third person help to create a new life. This process is called a third party reproduction. So when doctors do advise the third party reproduction. So what are the elements in the third party reproduction? There are three elements in the third party reproduction. That first one is the donor sperms, the second will be the donor eggs, and the third will be the donor embryos. So today let us know about the donor sperm. So when the doctor will advise to go for a donor sperm, when the husband is labeled as azoospermic. So azoospermia is nothing but there is no sperms in the seminal fluid. So or a husband is having severe oats. Oats is nothing but severe oligoasthenoteratozoospermia. It means a husband is having husband's sperm is very low count and a very poor quality sperm is seen. So then the doctor will advise to go for a donor sperm. So the third will be the repeated IVF failures or recurrent miscarriages. Then the other indication is severe RH incompatibility, or the last indication will be the single unmarried woman or a single divorcee woman when opted for children can go for this method. Then the sperm donation process is done through the ART bank. ART banks are the legalized procedure, legalized bank run as per the government guidelines. So how a sperm donor is selected in the ART bank. Sperm donor should be about 21-year-old and less than 45-year-old. He should be physically and mentally healthy. This has to be tested and proved, and he should not be suffering from any genetic disease or a carrier of any genetic disorder in him and in his family tree. This also has to be tested and proved. Then only this semen is collected and semen analysis is done. This also has to be in the normal limits. It means that normal good sperm count should be present and a good quality sperm should be seen, and it should be free from the virus like hepatitis and HIV. Then only this is cryopreserved in liquid nitrogen for a period of 6 months. After a quarantine period for 6 months, again it is subjected for semen analysis to prove that the semen should be in normal limits. That means a normal semen count, sperm count should be present, and a good quality sperm should be present, and it should be free from the virus like HIV and hepatitis. The idea behind doing all this is to donate a healthy sperm for a needy couple. How do ART bank people match the needy? How do they match with a needy couple? So some criteria will be taken like a blood group, eye color, hair color, skin color, and minimum physical characteristics. If matched together, then the process will be done. So this is a completely legalized procedure, and complete anonymity is maintained throughout the procedure. The personal details of the donor or a needy couple is never shared to anyone. So if at all it is needed, this if your doctor advised for the donation process, please go for this procedure, and if required. So next video I'll tell about the egg donation process. Thanks for patient listening.